Many a times when we plastic surgeons, when we are actually attending functions, social gatherings, or when we are with a group of friends, and they all know that we are all plastic surgeons, we do a lot of things. So one question which comes into their minds is, how does one prepare for a plastic surgery? Now, as a plastic surgeon, I can answer this question, but from a very ethical point of view, because it all depends on the outcomes and the results and the happiness which probably lasts after this particular surgery. So the first and foremost thing which anybody must do is to seek out a plastic surgeon who is qualified, who is experienced. When I say qualified, the particular plastic surgeon must be having a board certified degree and must be experienced. Now, only when you have a qualified doctor who is operating on you can you expect a desired outcome. The second most important thing which you must understand is the outcomes also depend on your expectations. You might have a patient who might have very reasonable expectations. Let's say a patient might just want to correct a nose which is looking very flat, and it's okay that as plastic surgeons, it's in our armamentarium that we can correct such a deformity. But there might be, on the contrary, there might be a patient who feels that he requires the nose of an actress or an actor. So this is an unreasonable expectation. So this is where an ethical plastic surgeon would actually red flag this kind of a requirement and tell the patient that it's not possible, and so will not do the operation. So this is very important, because if inadvertently we take up this patient, we might end up making this patient very, very unhappy, and it is not good for the plastic surgeon, because nobody wants to earn a bad name or repute after doing such a surgery. So it is important that the patients and the doctors meet, have multiple consultations just to understand each other, and then get into kind of an agreement as to what is possible. So when we actually operate on patients, typically we spend at least 1 or 2 sessions trying to understand each other, and their expectations are matching our expertise. That is when we agree and do an operation, and this all results in a very good outcome, and of course the patient is absolutely delighted once he gets whatever he requests. So it's very important that a plastic surgeon picks up these kind of requests. So requests which are unusual or which are very, very demanding, we must be in a position to tell the patient that it's not possible. And similarly, there are also patients who have a condition called as body dysmorphic syndromes, where they are excessively attached about one particular attribute, and they keep on thinking about those things. No matter how good a plastic surgeon is and how much expertise goes into the technique or the surgery, the patients will continue to be unhappy because of the body dysmorphic syndrome. So these body dysmorphic syndromes must be identified during the consultations, and these patients must be referred to the psychiatrist so that these can be addressed. So often at times we have to desist operations. We have to tell the patients, look, you're not a good candidate for operation. You probably require a counselor's help to correct your mental problem. So it's wise that you choose your patients well, and also wise that the patient chooses his doctors well.